Awesome. Hello, everyone. Welcome. We're so excited that you are here, that you joined our very urgent event. We're going to give folks maybe like 30 seconds to log on before we get started. Jackie, do you mind pulling the slides up? Awesome. Awesome. Okay, so I'm going to go ahead and kick us off because we don't have too much time together and we're going to cover some really important material. So I want to start off by saying welcome, everyone. Please feel free to say hi in the chat, your name, where you're logging in from, why this matters to you. Would love to just get a sense of who's here with us today. And I'm really grateful to be here for such an important topic and opportunity. MHA has been working on this for a long time and are really grateful to our partners at Active Minds and Young Invincibles who are joining us today. My name's Kelly Davis. I'm the Vice President of Peer and Youth Advocacy in Mental Health America's National Office. I think most importantly for this conversation, I'm a person with lived experience. So my experience, I had my first suicide attempt when I was 10. And like many, spent my middle school, high school, early life in all sorts of different levels and intensities of different types of treatment. Got to college and was on the verge of failing out, losing my financial aid, and was diagnosed with bipolar disorder. And like many folks, again, was given the message that, you have a serious mental illness. People like you don't do well, especially not in college. Go home and don't stress yourself out too much. And for me, it was really disability accommodations, peer support, learning from other people with lived experience that actually gave me a life and maybe know that actually we do belong in higher education, and it's extremely important for folks to not only share their experiences, but also work together to create campuses where any student gets access to the education they deserve. So today we'll talk about the current opportunity at hand and to share about your experiences and recommendations. So we're going to start with Mary Giliberti, MHA's Chief Public Policy Officer. She'll discuss what a comment is, what's the Department of Education, why does this matter, how you can take action. We'll have a panel where we'll discuss some of the things that are going well and what needs to change with a group of advocates and folks with lived experience. We have Randy Moore from Active Minds, Sasha Taylor from Young Invincibles, and Delisha Thompson, an organizer, most recently with the Bazelon Center, a co-lead for MHA's year-long disability and accessibility project, and an incoming law student and disability activist. We'll also talk about our action alert link that you can complete throughout the session. We'll drop it in the chat. You will be sent the link as soon as this event closes. This is where you will take action, where you will advocate, and we'll also follow up with this recording of today's session, more information and a link via email. This is all very time sensitive as these comments are due on Sunday. So now, without further ado, I will turn it over to Mary, who will share background, overview information, what we're talking about today. But please feel free to drop your questions in the chat so that we can have a conversation with Mary. I'll read them aloud and we can make sure we get your questions answered. And I will turn it to Mary.
All right. Hello, everyone. I am MHA's Chief Public Policy Officer. What does that mean? That means that I oversee all of our work on federal issues, so with federal agencies and with Congress. And so what I'm going to be chatting with you today is about federal agencies, which I know something about because I worked at the Department of Health and Human Services in the Office for Civil Rights for about 5 years. And so next slide, please. And so what I'm going to talk about is what is a comment and what does it matter, right? Do they read them? Do they care? What are these things? So federal agencies ask for comments or responses in 2 formal ways. The first is a request for information, and that is the one we're going to be talking about today. And the agencies do that when they want some information. They want to understand something better. That, think about it. Most federal agency employees, maybe they go out and see a couple of programs, but they certainly can't know what's going on all around the country, right? And they can't know the perspectives of all the different folks that might have an interest in whatever the topic is. So they do a request for information when they want to understand things better. A proposed rule, and some of you may have been on these town halls when we've talked about rules, that's very different. That's when the agency has taken in information and now they are proposing something. They've got an idea. And then they want you to say, hey, it's a good idea, it needs a little work, or it's terrible, right? And that's your comment. With a request for information, you really want to get into details. You want to tell them a little bit more than just, you did a good job, right? They really want to know what you think. And I'm going to get into the different ways that you can comment. But I wanted you to understand the different ways that agencies seek information. Next slide, please. So this is the Department of Education. This is their operating structure. And what we are going to be talking about is the Office of Post-Secondary Education. So that's the second one on the right side. So all the way on the right, the second office down, the Office of Post-Secondary Education are the folks that put out this request for information. But I wanted to show you this slide so you can see the Department of Education, like all federal departments, has a lot of different pieces. So you could see requests and proposed rules from any of these different offices. Next slide. So what does the Office of Post-Secondary Education actually do? So this comes from their website. At the bottom line is they work to strengthen the capacity of colleges and universities, and their goal is to increase access to and completion of post-secondary education, basically college and graduate school. They have 3 divisions: the Higher Education Programs Division. That division administers grants that improve academic quality. They also administer grants for students, particularly low income and first generation students with disabilities. They have an Office of International and Foreign Languages and an Office of Policy, Planning, and Innovation. And that office is going to be the one that does some of the guidances, the rules, those kinds of things. Next slide. So how is education going to use this RFI? Well, when you look at the RFI, if you look at it, it has the name of somebody to contact. And I asked her, I sent her an email and said, how are you going to use this? Because I wanted to be able to talk to you about that. First, they're going to use it for planning and shaping future events. They're going to use it for resources and publications that they put out to colleges, to students, to all their folks that care about their issues. They're going to do guidance and technical assistance. That's how they tell universities, good examples of things that they could potentially do. And budget proposals. Every year, every agency and each department of the agency tell Congress how much money they would like. And they have to back it up and say what they're going to use the money for. So this is information that they can use to articulate why they need certain resources. And the goal overall of our work together is to make sure that whatever education does to address mental health is informed by young people. Because typically the people who respond to these are the colleges, are people who are funded to do so. And it's really important that they hear from everyone. Next slide. So what's helpful in a comment? What should you be thinking about including? Well, first and foremost is lived experience. What have you experienced directly? And stories are super powerful. When I worked at the agency, I can still remember some of the stories in some of the comments that we got. For example, we did a regulation on healthcare discrimination, and the stories of people with substance use who couldn't get primary care, what they went through, that has stayed with me. I still remember those stories. So areas where you have experienced problems, discrimination, lack of access, and also things that are positive experiences. Because again, they want to provide guidance. They want to say this is the right thing to do. You can also include experiences that you are aware of. I saw a number of you in the chat put down organizations that you belong to, communities that you work with or are part of. What have you observed others having when it comes to good or bad experiences. When I was in college, I had a suite mate who had multiple mental health crises and got really poor follow-up access to care. So that would be the kind of thing that you could put in about what you've experienced and then what you've seen others experience. And then any information that you have access to, data, reports, news articles. You don't have to go out and do research, but maybe your organization has produced a report or you're aware of something that isn't, well known. You've seen a report or you're aware of something that you want to include. You want the agency to be aware of. You can include that as well. Next slide. We're going to go to the panel next. So I just want to conclude by saying that, I really appreciate everybody being here. And there's a quote that I like to take into this work, and it's from Angela Davis. And she says, "I am no longer accepting the things I cannot change. I am changing the things I cannot accept." And the discrimination and stigma and things that we see every day for college students is something that we no longer want to accept. And I really want to thank all of you for spending the time to put together these comments, which are important to changing things. So thank you.
Thanks so much, Mary. So we're going to open it up now for any questions that folks have. I have one question from Yulia who says, "How long is the comment? I know SAMHSA committee on SMI, it's 3 minutes only."
So this is a written comment. It's not a verbal one. And unfortunately, our system has, I think it's 3,000 characters. Is that right, Kelly? We do
5,000.
5,000. Okay, 5,000. So that means that, you can't write an indefinite amount, but that's a pretty good amount. So I think you should have room for, your experiences and the kinds of things that we've said. In addition, the alert that we're going to send you has a number of questions you can answer. You don't have to answer all of them. If you don't want to answer some of them, just delete them out so you have more room to answer the ones you do want to answer. So our system will take about 5,000 characters. So, you should have plenty of room to write your response, but it's written, not verbal.
I would also say that, we have our action alert that provides context and guidance and information, but you can also, if that doesn't work for you, if you want more space to write, you can submit the comments directly as well. You don't have to go through our action alert. So you have access to our action alert that can be helpful in kind of crafting and framing your response. Or we also have the link directly to the RFI so you can respond there.
It's really important to tell your story, to take out what we have, or you can leave it, but add to it. Because this is an RFI. Remember what I said, that those are where they're looking for that information from everybody.
Okay, we have a couple more questions. So Kyra says, "Do you have ideas on how to advocate for changes in policy at your individual campus? I recently proposed a policy allowing excused absences for mental health, but I want to make sure it is perfect before it is approved by our Senate."
Is that a state statute or within the college? I'm not sure. There are state statutes about unexcused absences, and then there are college proposals at the university level. So we can show you some examples of some of the statutes. We have a report that has that language that was used, and you can take a look at that, and we'd be happy to follow up with you and take a look at what you're proposing.
It looks like Kyra said college level. So I would actually also say Randy from Active Minds is on, and he's going to be talking about their work. And I know that they have a lot of materials and guidance for how to advance specific policy priorities on your campus. So I think he'll also be able to provide a lot of context and information that could be supportive and can probably connect you to their team, but also students who've done it themselves. Okay, the chat, and there's so much going on. All right, let me find something. Let's see. Can you upload URLs of videos of people telling their stories?
That is an excellent question. I don't think our system allows that in terms of our alert system. I'm not sure.
I
Kelly,
think
what do you think?
I think if you put the URL in there, it will show up for them and they can copy it and watch it. But I
Oh,
don't,
definitely. Yes. I thought you meant you wanted to upload the video itself. If it's just a URL, yes, I think that would work and you can send the link. Or you also, like we said, on the RFI, it gives you the place to comment. You could also do it that way.
okay, great. Next question we have, and then we have about, 5 or so more minutes for questions. So I have a question from Robert. Well, Yulia, I see your response about where you can find the questions they're asking. As soon as I ask Mary this question, I'm going to put everything in the chat for you and for everyone. Question from Robert. This is for Mary. Where do you believe colleges and universities lack the most when it comes to mental health support? I'm currently working on a mental health campaign for my campus community.
Yeah, that's a great question. And I do think it varies by campus. So I know that the JED Foundation has like an assessment that you can do. I'll just give you an idea of some of the things that I typically see, but I think each college has to be assessed. Some areas are things like accommodations where it's very hard to get them. And the process for getting them is very cumbersome. And then professors don't always know and accommodate. So I think that's one area I've seen a lot of issues. Access to care, there's long wait lists in some colleges. Crisis care is not particularly good on some campuses. Those are some of the things that we can see frequently, or even how they respond. Sometimes students are forced to take time off that they don't want to take, and that is highly problematic response to students with their needs. So I think that it varies by campus, but there are some commonalities and some ways that you can assess. And I would definitely say the JED Foundation has some good materials, and I know Kelly can put others in the chat for you to assess what's going on and then kind of move from there.
I want to read, Terry has asked a couple of times, so I want to make sure that I ask Terry's question. My question is, how can you reduce the stigma of ageism and discrimination for non-traditional mature students?
Well, in this instance, when it comes to comments to agencies, I think they take all comments. And so you won't have that same issue. But if you're saying on campuses where you're not treated the way you should be treated, age is a factor of discrimination. So there is an age discrimination statute. And so that's an issue that you should not experience age discrimination of any kind. It protects people who are 40 and over. So I think that's something to talk about with your student office that deals with the needs of students. Any student office, dean of students, if those issues are coming up, because it is not something that you should be having to deal with.
Okay, looking through some of the additional questions. Yeah, I see another question again. Yes, you can send your comment through the MHA link, or you can send it directly to the RFI site. I'm going to keep spamming the chat with the links, but then actually the way that Zoom is set up, as soon as this closes, it should take you to the link. And we're also going to follow up tomorrow with this recording, as well as the links that we're talking about today.
And I just really want to encourage you to do it. When you get off this, go ahead and take the action, because sometimes people come on and they don't actually do it. They really want to hear from you and they do take it seriously. So please, please just take the time.
Okay, next question. How can I get more involved in advocacy as a young innovator?
That is an awesome question. I think that you can get involved in advocacy at all levels. So many organizations like MHA and others have local chapters. They all do advocacy at the local and state level. We have an advocacy listserv. We can throw that in the chat. You can sign up for that listserv. And anytime we're advocating on Capitol Hill, you will get an alert, which you can send in. So we have lots of ways for people to participate in advocacy at all levels. I think the important thing is to think about where you want to make a difference, and then, work in that area, whether it's with your school, with your organization, and your community at the state and national levels. So there's lots of different ways to make change. And we love to have more people involved, taking action. So when we do an action alert, I worked on Capitol Hill too. They do look at how many people care about issues. So there's lots of ways to get involved that make a difference.
Yeah, and I'll just say something. So, Active Minds has chapters, Young Invincibles has really cool programs as well that train folks on the regional level to get involved in policy advocacy on mental health and some broader issues. I think one of the things, we at MHA also have a number of youth leadership programs. One's focused on policy, one is kind of broader, but one of the things I also think that's really interesting is that there's so many ways to do advocacy. When I was in college, I think I thought that policy was the only way to do advocacy, and also that you had to know a trillion things to be able to say anything about policy, and felt really intimidated. So one, I think this is a really great opportunity for you to write out what's important to you and get your thoughts out, and you can edit it or include what matters to you. But the other piece too is I think that it's also great to kind of get exposed to some of the different approaches that people have, whether that's mental health journalism, mental health and art, kind of doing peer support in your community. So I'll share our website with some of the different programs that the youth leaders who we work with have also created, because I think there's so many different options for how you can really get involved. Let me see. Okay. Yulia said, that's great that you oppose forced leaves of absence. Do you have any position on students sent by campus police for forced treatment?
We do have a policy on forced treatment in general in our policy positions, and we can put that in the chat. Generally, MHA believes that people should receive voluntary treatment. And so you will see our policy position on involuntary treatment. We do everything we can within crisis systems to advocate for a healthcare response and not a law enforcement or an involuntary response. So we think that's really important as we see more and more crisis systems being set up, that people really make use of peer support. And you'll see there's a question in the RFI about peer support. So I would urge you, whoever asked that question, to really put in there the value of peer support, particularly in a crisis situation, to avoid the circumstances that you just mentioned.
Yeah, and I'll just echo that in that, yes, we also, through the project that we've worked on over the past year or so, have listened to a lot of folks. I'm a person with lived experience in how can we advance non-coercive resources. So like Mary is sharing peer support, peer mobile crisis. There's some weird stuff that we've bumped up against with the campuses and mandated reporter laws, but I know that, for example, Rose House, which is one of the peer-run respites in New York State, has relationships with schools for students, because I think a lot of times, your students are even trained with a lot of education to tell their peers to go to the emergency department or to call people to respond to their peers, even when it's not necessarily a real crisis where they feel in danger. So I think, learning from the peer support movement and building relationships with community organizations that already have this expertise around mental health and human rights, and also non-coercive support and resources. I worked with the Doors to Wellbeing and Mark Salzer at the Temple Collaborative on a paper on how college campuses can learn from the peer support movement and involuntary response, student rights, things like alternatives to suicide programs that do not punish students for talking about wanting to die. Those are all things that are really important to us, and I think that campuses should really learn from the movement and community. I'll also drop that link in the chat as well. Okay, one more question, and then we have to wrap up. Let me see. Let's see. Okay. Hillary There's a lot of advocacy happening in many states too, at the local, university, and state level for ending unpaid internships for social work students. Payments for placements, unpaid internships have been associated with negative mental health outcomes and food insecurity. Most helping profession degrees require unpaid internships.
Yes, I think that's a critical issue. And we at MHA have been working to get more money into training programs so that people can be, not go into debt either trying to get their training program, but getting paid for your work is really important as well. We know that that's a major issue. It causes a lot of inequity. I mean, we don't see as diverse a group of providers as we would like, and these things drive it. So I think that is a very important issue that needs to be raised both at the campus and at the policy, state and federal level as well. So thank you for raising that. We do need to keep it top of mind.
Yeah, just a side note, there's someone who, I don't know if you want to get in contact with this organization, someone who I went to undergrad with. There's an organization called Pay Our Interns, and they've done really phenomenal advocacy, changing definitely at the federal level, the pushing away from unpaid internships. I could not have interned as a student if they had an award for Pell Grant recipients. I could not have done it, and it's really, really a horrible way that perpetuates a lot of the inequities in the
And
field.
some states have a lot of hours required too, which I think is also a barrier.
Yeah, yeah, totally, totally. Okay. All right, one more question, then we have to move on to our panel. I will keep an eye on the chat as we're talking and pull in some of the questions. Two quick ones. How many words should the comments be for the best success? And then you mentioned to submit it by Sunday. When does it close on Sunday?
It's interesting. I don't know about words. I would keep it tight. In other words, they're going to think about the fact that they're reading thousands of these, right? So I would keep it to just the critical aspect of whatever it is. I always tell people boil it down. Don't give every little detail. It's really like, remember, this is somebody sitting in a federal office reading it to inform their work. Okay. So you want to keep it. I would say each question you could write 1 or 2 paragraphs for each question, and that would be great. So I think, don't overthink it, and you don't need to write a ton. It's actually more important to just get them the experience and the thing that you really want them to get across, right? Think about what do you want them to come away with and make sure you get that in.
Awesome. Well, thank you so much, Mary. This has been so helpful. Thank you everyone for asking your questions so far. We're going to move on to our panel discussion. And again, this recording will be available. I'm going to keep spamming the chat with links, and then we'll follow up with all of this tomorrow. So thanks again, Mary.
Thank you.
All right, so turning over to our panel discussion where we will get into some of the details. Someone asked a question about Yale, definitely something we're thinking about. So we are going to explore perspectives on what's happening, barriers, and solutions. I'm going to introduce our panelists, and then we'll go through some questions before we wrap up. So first up, I want to introduce Delisha Thompson. Delisha is a mental health, disability, and campus activist. Most recently was a national campus mental health organizer at the Bazelon Center for Mental Health Law. Mary used to work there. I interned there. They were involved in the Yale case. They've been involved in many of the they're a litigation firm, even though they do advocacy. I highly, highly recommend checking out their resources because they've been the leaders in suing campuses for discrimination. So I'll drop that in the chat once we start our conversation. Delisha has been a leader in college mental health for a number of years and will soon be back in school for law school, where she'll continue her leadership in mental health and disability advocacy and activism. Next up, I want to introduce Randy Moore. Randy stands at the forefront of social justice and public health advocacy with a life deeply transformed by his own experiences with mental illness since childhood. A self-made success story, Randy dropped out of high school after the 9th grade, leaving a segregation academy in pursuit of an education that could empower him to combat the social injustices prevalent in his rural South Carolina community. His impactful work spans from advancing civil rights with SC equality, playing a crucial role in the legalization of marriage equality in South Carolina, to leading mental health reform initiatives at Active Minds, Inc. Randy has significantly influenced legislation through his advocacy, focusing on LGBTQ and BIPOC youth, and has worked on critical bills aimed at improving mental health access and care. His efforts also extend to combating homelessness and housing instability in Virginia and enhancing public policy and community outreach as an outreach representative for Senator Mark Warner. With a solid foundation in research and policy analysis, Randy's career is marked by his dedication to driving social change and supporting vulnerable communities through policy initiatives and active community involvement. And then last but not least, we have Satra D. Taylor. Satra is the Director of Higher Education and Workforce Policy and Advocacy at Young Invincibles, leading the overall strategy and positioning on higher education and workforce issues. Satra is an experienced equity advocate, leveraging policy partnerships and research as levers for social change in higher education. Within her career, she's acquired expertise in engaging coalitions, managing collective investments, public speaking, writing for diverse audiences, and equity-focused policy analysis. She's also served as a senior administrator for a social justice grassroots organization, leading its strategy on community engagement and organizational impact and effectiveness. Before that, Satra led policy strategy for a national policy and advocacy organization, culminating in the restoration of Pell Grants for incarcerated students. Satra has attained strong content expertise with a master's degree focused on educational leadership and policy from the University of Michigan, and is a current doctoral student studying higher education at the University of Maryland, College Park. A native of Cincinnati, Ohio, Satra obtained her bachelor's degree in psychology from the University of Cincinnati, and really grateful that she and all of our panelists are here. Clearly, we have amazing people who also really love higher education. So to get us started, I think first connecting with the personal is always really important. I want to start with you, Delisha. Can you share a little bit about yourself and your connection to this work?
Absolutely. Thank you so much for having me. Again, my name is Delisha Thompson. Um, I have diagnosed chronic depression and anxiety. And I think my first dipping my toes into this work was all of my negative experiences trying to get accommodations at the University of Maryland, and subsequently as a teacher at the University of Maryland, watching my students drop out due to mental health concerns. We had a hate crime murder on our campus, and people's inability to access mental health related services in the aftermath of that event. And even overseas, I saw that with my students that I worked with in Taiwan. So this is not even just a domestic issue for me, it's a global issue that I hope to work on. And I feel like the reason that my work with Kelly and others has pivoted me toward law school is I feel like, unfortunately, that's the most effective way to force schools to do what they should have been doing in the first place, which is making sure that they provide adequate and accurate services for our students. And I'm happy to go into more about my work with Bazelon and the PCORI project, but suffice to say that I'm so happy to one day be suing schools in the future to get what we need to get done.
Thanks, Delisha. Randy, I'll turn it over to you.
Absolutely. Well, my name's Randy, and I grew up in rural South Carolina and into a strange situation where I found myself at the kind of in history where segregation academies still existed. And, while there was not explicit segregation, we were still kept separate in that environment. But as that was kind of happening, just a host of my own traumas from childhood, being from one of the poorest counties in South Carolina, growing up between South Carolina and Appalachia, where my dad's family were from. I didn't have the support that I needed to address what ultimately was diagnosed when I was about 8 was serious mental illness. Over the years, I experienced various degrees of diagnoses. None of them really made sense, and was in and out of hospitals and treatment systems, trying to figure out what was going on with me. And then after I dropped out, I decided to continue on with my education. I was lucky in that I was always really driven by a desire to learn and to use my opportunity to make a difference in the world and the injustices that I saw. And so I decided to pursue a career in social work, particularly macro social work, where I could address things at the systems level. And that led me across a variety of fields, from civil rights as it relates to LGBTQIA populations in South Carolina. I worked on campaigns. I did housing policy. I worked for Senator Mark Warner as his outreach representative, and now I found myself in at Active Minds, where I'm working on mental health initiatives. And really, that my draw to Active Minds was, I found out much later in life that I was on the autism spectrum, and that was not something that I had ever been tested for. And we know a lot more about that now than we did back when I was younger. And so working in Active Minds, I get to support a team and programs for individuals and youth that have an opportunity that I didn't have. And so it makes me really excited to know that, there are youth and young adults out there who or struggle, and they're able to go to their peers and to find the language to illuminate what it is that's happening inside. Because I know for me, that was such a struggle, and it was very isolating. And so, ultimately, I hope to give back in terms of the opportunity that I was able to be afforded, so that others, 15-year-olds like myself, don't have to struggle in the same way that I did.
Thanks so much, Randy, and for sharing. And I know, Randy, I think Randy, you have a podcast, right? And if you want to drop that in the chat for people who want to kind of hear more from you. And then now I want to turn it over to Saucha to share a little bit about your experience, and then we'll jump into kind of some of the work that everyone's organizations are doing.
Absolutely. And keeping an eye for time, I'll try to keep it brief. Hi, everyone. As Kelly mentioned, I am Saucha D. Taylor, the Director of Higher Education and Workforce Policy and Advocacy at Young Invincibles. And I, for the longest, have struggled with anxiety. And I appreciate the two panelists here from opening this space with vulnerability and courage, and allowing me to also share. And because of my background and where I come from, low income, so did not have many resources or access to quality healthcare, but also coming from a very religious background and having parents who did not necessarily believe in mental health wellness, it took me a while to actually seek out help. And it was not until graduate school at the University of Michigan when I just realized I could no longer take it. I had so much going on, my first time away from home. And if anyone is in grad school, you know that it's tough. And I finally broke down and went to the counselor's office and was fortunate enough to be able to find a counselor that looked like me. So as a Black woman, and who connected me with other Black women within the University of Michigan as a peer support group. And when I got to Young Invincibles years later and learned that this organization was also caring and trying to address the mental health crisis, I was super excited to see how could we amplify and lift up the work that we have been doing across the regions, especially with organizations like Active Minds, because I strongly believe that colleges and universities have a responsibility to ensure that their young adults are supported, their mental health, and that they're providing and nurturing their mental health. And so super excited for this panel and ready to talk more about what's ahead when it comes to holding institutions and the Department of Education accountable for supporting students on this matter.
Thanks so much for sharing, and thanks everyone for sharing. I want to echo the chat. Everyone, it's just really beautiful to hear your stories, and also kind of to just like witness the resilience, not just the resilience of the room, but also kind of the commitment. So I always cry. The commitment to service from kind of the things that really people tell you are bad about you and are the reasons you don't belong, especially not in higher education. So just appreciate all of you and sharing space. I'm going to turn it back to you, Saucha. So Saucha's with Young Invincibles. They do amazing work across the country. One of the ways that I first got connected to them was through their campus mental health checklist in Colorado. So I wanted to see if you could elaborate a little bit more about Young Invincibles campus mental health work and some of the recommendations that are important to you all.
Absolutely. So as my title alludes to, I lead the overall strategy when it comes to higher education and workforce, but I see issues such as mental health care or the intersections of healthcare and higher education daily. And my healthcare director, Martha Sanchez, and I got together and said, hey, we need to launch this huge campaign as an organization when it comes to mental health. And so we'll drop it in the chat, but we launched our mental health agenda called Mental Health is Preventive Health. And it's a mental health agenda for young adults by young adults. And it is underlining the importance of recent conversations we've had with young adults and intersections between healthcare, higher education, and financial well-being. Specifically with the Healthy Minds Checklist, which we actually did in collaboration with Active Minds in Colorado, is that it aims to create inclusive programs that enhance existing campus resources and benefit both institutions and students. So it's a win-win for all. And we have seen versions of the Healthy Minds Checklist successfully passed and implemented in states like Colorado and Illinois, where campuses are actively working to ensure that students have the necessary resources to succeed. We also would like to see at a national level a Healthy Minds designation. So some of us are familiar with the designation of historically Black colleges and universities, so HBCUs or predominantly Black institutions, PBIs, or HSIs, Hispanic serving institutions. So we are hoping to create a separate designation specific to higher education institutions who are all in when it comes to mental health. And we see this as a federal state partnership. So federal government would provide some sort of funding for colleges and universities to meet them in the middle. Because one of the things we realized in Colorado and Illinois is we can ask institutions to do all these things for students, make sure they're having events on mental health wellness, making sure that they have staffing and that the staff are culturally competent, but they need the funding to do so. They need the funding to hire people. They need the funding to ensure that a yoga instructor can come and teach yoga. And so we're trying to figure out what is the best way to tie funding to this initiative that we have seen has had success. And in Illinois, they actually were able to get appropriations designated for this. And so we're really just trying to scale what we've seen in our regions.
That's so amazing. Yeah, I think there's individual things that are important, but like how do we at like a systems level like really make sure that it's happening and create kind of incentives for people to want to stand out for their commitment. That's really awesome. Randy, I want to turn it to you next. You know, I'm sure everyone in college mental health is familiar with Active Minds. So anything that you want to share? I think what I'm really interested in is, you know, Active Minds was really kind of the first or kind of one of the first organizations really out there starting campus mental health conversations. And in many ways, the conversation has really evolved since I think it was just your 20th anniversary. Can you share some of the big issues you're seeing right now and some of the solutions that are coming from the students involved?
Yeah, so actually, if you don't mind me, I have a little notepad over here that I will read off of. But you know, some of the things that we're particularly concerned about, of course, is leave of absence. You know, as it relates to leave of absence, we see that across the country there are a variety of, it's kind of like a patchwork of, you know, this school will require this amount of time that a student can go, and this will require none. And so we'd like to see some continuity in those practices across the country, because we want to see students be successful, and we want to see them you know, stay in school, you know, as they wish to, and to further develop themselves. You know, I think another important issue is mental health support for graduate students, because graduate students face a unique pressure as it relates to both the academic, the financial, and professional challenges. So we'd love to see universities develop mental health programs specifically tailored to the needs of graduate students that include stress management workshops, career uncertainty counseling, and peer support networks that address those distinct challenges. Cultural competency is a big one. You know, we know that BIPOC and LGBTQIA students, international students, these students that are more vulnerable experience these issues of mental illness at higher rates. And so we want to see colleges attempt to tailor their services to these specific experiences and create spaces for culturally competent support groups. The other thing that I think is really important and one that, resonates, of course, with me is like support for students with disabilities. I didn't even acknowledge in my personal life that I had a disability until I was much older in my late 20s, because of the stigma that surrounded that. But what I'm really encouraged by is through the work that I've been able to do with Active Minds and to see what's happening on the ground in Active Minds chapters is that stigma is really being chiseled away. And so for students that have invisible disabilities such as ADHD or autism spectrum disorders, developing specialized support services and accommodations for those students to help address this gap. And then, of course, preventative and community level interventions are so important, implementing programs that promote mental health literacy. I spoke about having that language that is so important to verbalize the internal world is so essential. And also teach coping skills. I learned a lot when I was recognizing how to understand what a cognitive distortion was and how to get around it. And so I'm sure that's not unfamiliar to you all, but not everyone has access to that type of mental health literacy. And so we think it's important that, universities really put themselves out there and making sure those resources are available. And then last but not least, just talking about the financial stress that college is not getting cheaper and nothing in this country is getting cheaper for that matter. And so, financial literacy programs, increasing access to financial aid resources, and offering counseling that addresses the stress related to financial insecurity can be effective strategies as well.
Thanks so much for all that, Randy. I think that that's so huge, it's like, it's great for you to tell me to take a break from college. Do you know how expensive college is? Like, do you know I have to maintain a certain GPA to keep the scholarship, otherwise I can't go here. I know folks who have had their credits trapped by their institutions because their leave wasn't approved. So they had to pay for they owed tuition for the semester, and they had to work for like 7 years to be able to transfer from the school. So there's some pretty horrendous stuff. I think along those lines, Delisha, my question for you, we've worked on this, and I think folks here will be able to relate, being labeled as, having a severe mental illness. A lot of times I felt like campus mental health conversations were not for me. They wanted to talk about stress and depression and anxiety, and they wanted me to not be at their school. So can you talk a little bit, our PCORI project, so we really focused on psychosis, self-harm, suicide, bipolar disorder, kind of some of the more stigmatized experiences that people have that people really shy away from in a lot of these conversations. Delisha, do you mind sharing a little bit about, your thoughts or some of the things that came up during our project around really making sure that we're talking about all students with psychiatric disabilities, not just mental health promotion?
Absolutely. And I will do that by also answering a very pertinent question that I saw in the chat while you were talking. And that was, do colleges and institutions have an obligation to address this issue? Are colleges and schools, shouldn't their just focus be education? And unfortunately, we live in the country where healthcare is not guaranteed. It is not a right. And if schools are penalizing students for not having health insurance and asking them to buy their insurance as part of them being at their institution, then in fact, you do have an obligation to address the mental health of your students on campus. Unfortunately, however, through our work, we have found that even though all of these programs, things that Satra is doing, things that Randy is doing, are increasing help-seeking behavior, increasing destigmatization, the schools are not prepared to handle the influx of students that are like, okay, it seems acceptable to ask for help. Now I'm going to ask for help. And the schools are like, whoa, we didn't actually want you to ask for help. So we have found like every year for the past 15 years that there has been a steadily 5% increase in the pressure on universities' mental health care apparatus and health-seeking behavior, and the schools can't handle it because there's also been a decrease in personnel. So what did the schools do? They end up, from our work, they have been finding fun ways to define what a reasonable accommodation is and using that as an impetus to punish students. The second most common way we've seen students be impacted is res life becoming involved and essentially having a Fair Housing Act violation by them using that as being like, oh, well, if you don't have any place to live, well, then you're going to drop out because most of us, that's the only way that we're able to attend our institutions. To what Randy was speaking about, a lot of graduate programs and professional schools have this very trial by fire mindset. And they're very like, oh, well, if you can't handle it, this may not be for you. Like you might not just need to leave. Instead of saying to themselves, isn't the very reason that we are pursuing these degrees of higher education to go back and help within our own communities in the first place? And particularly for issues of character and fitness, I can say this from the law school perspective. In many states in the United States, you can be barred from taking the bar exam simply by having a mental health history. And that is frankly disgusting to me that I should have to divulge all of this personal information and then that be an impetus to not be able to take the bar for many students, as well as I've been told many times that getting accommodations in law school is particularly difficult. So we have all of this great work that Kelly and other advocates are doing to help students ask for help, which is what we want. But institutions don't actually want you to ask for help because then they have to do something about it. And unfortunately, many of our schools treat mental illness like a virus. And particularly, as Kelly was saying, for our particularly stigmatizing diagnoses, schizophrenia, DID, and others similar to that. And it's not that we cannot complete our education. We can. We just need reasonable accommodations. And as Kelly was alluding to earlier with Bazelon, it's sad that Yale had to be taken to litigation simply to ask for things like, hey, can going from full-time to part-time be considered an accommodation? Wild that we had to sue you for that. So sometimes something that's reasonable that we think is already in place that an institution should already be doing, they are not doing. And it is unfortunate that at this course, they're finding interesting loopholes to get around their responsibilities to students. That's not even getting into the racial aspect, the gendered aspect, and all of the other ways that institutions are finding ways to harm vulnerable peoples and populations and to ensure that they're not going to graduate. I can tell you for a fact that at the University of Maryland, they keep track, and over 50% of the students unprompted said that when they dropped out, mental health was one of the reasons why they dropped out of Maryland. So schools are keeping track of this. They know how many students are dropping out. A lot of them know why they're dropping out, but they are not concerned because they are a capitalistic business. And as long as you have paid for loans or paid for your tuition, why do they need to care that they need to provide these services to students? Because unfortunately, health is expensive. But on the other hand, economically speaking, providing health and prevention to your students is cheaper in the long term than upfront the first time around. So I just say all that to say, please continue to come to these events. Please provide comments to the DOE. And like I said, if you yourself or one of your students is having these issues, like please feel free to seek me out because I am happy to use all of my acumen and knowledge and know-how of the system and their loopholes to make sure your student is being properly accommodated, as is their right under the law.
And Kelly, can I just add to that? And it actually answers one of the questions in the chat about like, what do you tell folks who say that it's not the responsibility of colleges, just adding to, right now, higher education is in a state of transformation, and many population, students, Congress are asking colleges and universities to be held accountable for what they are intended to do. And to everything that Delisha has said, we have to get back to why were colleges and universities formed? And when students are there, how are we ensuring that we are providing the resources that they need to be successful? It is not enough to provide access to students. How do we ensure that they complete college whole and well? All of the tactics, the weeding out tactics, like we are really trying to transform higher ed right now, and they're on a chopping block, rightfully so.
Yeah. Oh my gosh. Agree with everything everyone said. This is really, really an amazing conversation. It might take us like 1 minute over time. Because I just I would love to hear from you all. You know, there's so much that needs to be done. There's so many really important conversations. I think it's fascinating that was always the funniest thing to me. I was like, no one's talking about accommodation. Why do all the campus mental health conversations not talk about the school like that's so kind of, they're not talking about the education and how mental health impacts your education. So I there was just an article in the New York Times that I think talked about, you know, how we're at a point where so many students are struggling. We have to do like structural campus-wide changes. It's not about building enough individual therapists. It's never gonna do the trick to make sure students get exactly what they deserve. Everyone on this panel and everyone in attendance is going to be so inspired and submit their comment. So I want to ask each of you, what is your top comment or top recommendation when you submit the action alert? I'll start with you, Satra.
So I already talked about the Healthy Minds checklist, so I don't have to talk about that now. The second is increasing the number of trauma-informed, culturally competent mental health providers. And so we are looking at establishing a scholarship or expanding a loan repayment program under the Health Services and Resource Administration, or HRSA, for short, for mental health providers, including undergraduate students committed to pursuing careers in behavioral health. We are having conversations with the Department of Health and Human Services, as well as the Department of Education, to see what does this look like, because we know, to the conversations we talked about today, college affordability is an issue. So if we're trying to get practitioners, we have to make sure we're looking at the how are they getting inside, or how are they getting in these programs? How are they funding their education once they're there? And so hoping to make something shake with that so we can have more culturally competent, trauma-informed healthcare providers.
Randy, I'll turn to you next. Someone just quickly asked how to get more info on starting an Active Minds chapter. I put the website in the chat, but turn it over to you if you want to add any comments, and then for your answer.
Yeah, if you go to that website, that it lists all the chapters that exist, but you can also, it's like a how-to to, you know, what you need to get the chapter going. So feel free. But if you have any questions, reach out to Active Minds or reach out to me, Randy at Active Minds, and I can get you in touch with the right person. The recommendation, I'll make this quick, particularly I think when we talk about invisible disabilities like ADHD and autism spectrum disorders, you know, we're at a really unique turning point as it comes to technology and things that are happening with AI and with different things. And I think that universities have a real opportunity to get on the boat as someone that has struggled with processing disorder as as a result of my autism spectrum. Like having a transcript is like it takes so much stress off of my plate, even when I was in school or when I was in a working environment. So I think, you know, evaluating what that technological landscape looks like, what's on the horizon, and developing specialized supports and accommodations for students with invisible disabilities can help address this gap. And so I think this comes from a collaboration between disability services and mental health services on campuses and can ensure a holistic approach to support.
Thanks so much, Randy. Yeah, we hear from students accessing disability services that often the disability staff have no understanding of psych disabilities. So that's super, super important. And then Delisha, I will turn it over to you to take us home, and then I'll quickly talk about
Yes. I've been thinking about it, so I'm ready off the dome. So everything that Satra and Randy said, the biggest thing I think that these schools are able to hide behind and that I would suggest for the Department of Education to look into is forcing them to take all of the data that they are collecting on their own mental health apparatuses, their sort of I'm going to call it the watchful eye of how they surveil students and assess for threat assessment. I want that information to be forcibly given to the Department of Education because just like Satra said, how can I give you like a healthy minds like stamp that you're a healthy school if I do not in fact actually have data on how many students are dropping out, how many students are being kicked out, how many students are experiencing like things that are external that are contributing to them dropping out. If I don't have a transparent way to assess that data, then I can't actually hold you accountable. It's a secret. So that is my biggest recommendation in order to do all of the things that Satra and Randy mentioned.
Thanks so much, Delisha. Thank you, Randy, and thank you, Satra. This has been amazing. The chat has loved it. I'm honored and inspired to get to work with you all and share space. And there's so much need, and I'm just grateful that there's folks like you out there working on this every day. So thanks you all so much.
Absolutely. Someone asked about the Yale settlement. I promise if you type it into Google and you say like Yale mental health settlement, it will come up. Because I have to like, I don't know how much time we have left, but I'd have to search for it. But like, it's on Google. I promise.
I'm gonna drop in the chat. So I dropped in the Bazelon Center's website earlier. It's like the landing page is reading the Yale settlement. So you can find
Thank you, Kelly.
all of that info there. So we are 2 minutes over. So I just wanted to take a minute to say thank you all so much. So our next steps from here is taking the action alert. As we've talked about a number of times, we have our action alert through MHA. If for any, if for any reason, you feel the need to submit directly to the department, we also have that link that we will share. Again, you don't have to know everything. You don't have to respond to every question. We really need your story, your experiences, your ideas, your suggestions. Your campus did not have to do a good job. Most campuses do not do a good job, but the ideas that you have from your experience, from the things you've heard today are really important. And we need to make sure that the department actually hears from people who have been impacted and will continue to be impacted by their decisions. And please complete and submit it by Sunday because that is when it's due. Next slide, Jackie. The link has like a full explanation of all of the things that we talked about today. My email is on there. You can email me with questions. You'll get the link as soon as this Zoom closes. We'll send an email with the recording and this info tomorrow. I'm going to ask Young Invincibles and Active Minds and Alicia to share links of things we discussed if you want to include them. Please encourage your friends and networks to share. The biggest predictor of whether or not someone volunteers is if they're friends with someone who volunteers. So please encourage your peers. Again, submit by Sunday at midnight Eastern. If you have any questions, you can email me. My name is Kelly Davis, kdavis@mhanational.org. And yeah, thank you all so much for joining us for your work on this important topic. And hopefully we'll overload them with messages. So thanks, y'all.
Thank you so much.